A record number of people are languishing in Texas county jails, locked in limbo, awaiting a state hospital bed for mental health treatment they need in order to stand trial. And now state leaders are grappling with how to tackle this costly crisis. We previously reported the number of inmates waiting in that system hit a record in November of 2019 with 1,017.
It dipped after that for a few months, but by mid-2020, the number was rising again, hitting a new record last December of 1,508, and it remained higher than the previous record in the months to follow.
KXAN investigator Josh Hinkle explores new efforts to help reduce this backlog, which has grown during the coronavirus pandemic.
I'm at San Antonio State Hospital. It's giving me insight. It's giving me time to reflect. It's giving me time to judge myself, time to think about my past, everything I've done, try to work on the future. For me, it's extremely important to stay on medication because it helps me, it helps take the edge off. It helps keep me stabilized. We've been having therapy for about 4 or 5 months already. And that's been extremely beneficial to my mental health.
When we talked to your mother originally, we kind of talked about the time before when you were going between jail and a state hospital and kind of back and forth.
They'll say you're competent and competent and competent and competent, send you back and forth to jail, and the psych ward back and forth like purgatory. It's a loophole.
This is a meeting of the Joint Committee on Access and Forensic Services.
Notable here, the wait list, we did see in December, it did get over the 1,500 mark.
Also, the average length of time waiting is at an all-time high, which is up from our pre-COVID level of 70 days in March.
Why has the pandemic worsened this issue?
There's not as many personnel and many times to take care of people and to address their needs. There's a real slowdown in the court system, which is how people are directed to state hospitals. Our concern at Texas Jail Project is that the legislature thinks that the problems are pretty well solved because they've created a lot of funding for state hospitals to be renovated.
You talk about the legislature. One of the areas we've been looking at is legislation that's been introduced to create a forensic services office for the state that would really look at this data and help really focus on this problem.
We need to throw a lot of energy behind this to make sure that those who are not able to protect themselves and protect their liberties have the ability to speak with a defense attorney in a meaningful way. I have had calls from family members as well as defendants after they've been in jail, talking about their experiences in a psychotic break, in a rubber room, having been stripped of their clothing because of fear that they would hang themselves, being cold and naked in a jail cell while awaiting appropriate mental health care. I'm having a difficult time understanding why things like healthcare are not a priority in this legislative session, particularly in light of the pandemic that we are still in the grips of.
They just opened up May 3rd. We can have visits. So I got a visit not too long ago, like the day before Mother's Day. My mother visited.
What was it like to finally get to see him?
It was wonderful. It really was. It's been over a year.
What do you tell Adan when you leave at the end of a visit?
Think positive. Try to keep perspective. Be hopeful. Change is right around the corner.
To give you an idea of just how much time Adan spent in the hospital, he's been able to write a handful of books, including this one called Chest Perception. It's about his time as a Marine and the mental health challenges he faced after. In it, he writes he hopes it will open eyes and help those who need it. It's part of the holistic approach to treatment that Adan is taking after spending years in the criminal justice system loop. Remember Senator Sarah ECKHARDT, who we spoke with in the story? Well, it's also a point she wanted to include in her legislation, considering a continuum of care beyond any criminality. And it's also something she wants to revisit when she refiles the legislation in the next regular session in 2023. At the state capitol, Josh Hinkle.
Thank you, Josh. Senator ECKHARDT also tells us if there's any pushback about the cost of the statewide office to address the backlog, it's easily answered. She plans to push an outpatient approach for mental competency restoration instead of relying so heavily on state hospitals and jails. She says money would be saved in the long run because jail bed days cost taxpayers a lot of money. By the way, updated state data should be out tomorrow, and we will update you on how the waitlist numbers have changed this summer. Catch up on our complete investigation by going to lockedinlimbo.com right now.